One of the best ways to grow your niche dental practice as an orthodontist, an oral surgeon, an implant specialist, or a sleep specialist is to market for big cases. The question though is, how much should you spend and how much should you expect in return? I'll be back with some thoughts after the break. Welcome back. I'm Colin, receiver, and this is the Patient Attraction Podcast. There's big money in big cases, and the big cases are people with severe dental needs and deep disability. Those needs include fixed prosthetics on existing teeth, implants, sleep apnea, orthodontic issues, general restorations, and perio problems. Now at SmartBox, we tell our clients, market to the patients that you want to attract. Experience shows us that when you market to people with one severe dental need, you get calls for everything else as well. One thing to consider before you begin marketing to attract big cases is how you'll deal with the overflow of cases outside your niche. If you can comfortably expand the range of services you offer, that's perfect. If not, you should have a tight referral system in place to handle the cases that you don't. Now let's deal with the big question here that I hinted at earlier. How much should you invest in marketing to people with severe dental needs? Now that depends in large part on first where you're located and second, how broad of an area you want to target. But let me give you a general range to chew on. Somewhere between $1,500 and $5,500 a month should result in enough calls to make it well worth your while. Once your marketing plan is in place, how many calls should you expect? Again, that's a function of your service area's population and the frequency of your marketing. Calls might range from a low of 40 in more rural areas up to 60, 70, 80, 90 calls in more aggressive urban markets. There's no way to be certain what your particular market will generate, so take these numbers as rough guidelines. But once the phone starts ringing, make sure you're converting these prospects into paying patients. That's where phone training and phone tracking is invaluable to showing your results. Now, we give away our phone tracking system, Zetetics, to every client that we work with because it's imperative that you know exactly which marketing vehicle elicited and charged each phone call. That makes it easy to figure out what's working and what's not. And every phone call is recorded and easily accessible via our database. We listen to every call and we grade you and give you the results of how many appointments you're getting from your marketing campaigns. Now, if you're not getting the conversion that you expect, you can also listen to the calls and see if a staff member might be taking the wrong approach with those calls. So to recap, you can expect several things when you market to people with deep disability. You can expect a lot of calls that don't fit your niche. You can expect to invest somewhere between $1,500 and $5,500 a month. And bear in mind that it might take several months to get the kind of response that you're looking for those deep disability patients to develop the name recognition and trust with you before they pick up the phone and call you. You absolutely must convert as many of those callers as you can into appointments because it's all a building of trust. And make sure that the calls are being handled appropriately. You got to have a good phone tracking system in place. Do your prep work, have a plan in place, give your big case marketing a good chance to reach your audience. Now, tomorrow's podcast, I want to begin a 2-day series on marketing to men of a certain age. Until then, keep moving forward.